Welcome to this Clinical Appraisal Skills video workshop. The purpose of the films you're about to see is to surface some of the behavioural challenges of clinical appraisals and to encourage you to explore helpful behaviours, strategies and mindsets for these important meetings. The information, ideas and suggestions contained in this video are by no means definitive. They're intended to act as a provocation, to encourage you to consider, reflect and discuss good practice around these important conversations. Follow the instructions on the video and ensure you allow time to consider what you've just seen. So, let's first meet Jenny, our doctor, and then John, our appraiser.
Hello, my name's Jenny Squire. I'm a senior consultant and I've been at the NHS, frankly, since God was a boy. I'm here awaiting my appraiser. I don't really have much truck with appraisals. That said, I am here awaiting him. I hear he's quite junior, but I don't know who he is. I hope this doesn't take too long because, frankly, I have a very important luncheon appointment with the medical director.
So, hello, my name's John Tillery. I'm about to do an appraisal on Jenny Squire. I have to admit I'm still fairly new to all this and it's taken quite some time and a lot of chasing to set the meeting up. I've not met Jenny before, but she comes with quite a fearsome reputation, so that's concerning, and there is a bit of a lack of detail in some of the forms that she was meant to fill in, so I'll be honest, I'm not really looking forward to this. Anyway, here goes.
What do you notice about how John the appraiser is talking about this meeting before it starts? What impact might these thoughts have? What might be a more helpful mindset? So let's take a look at the opening minutes of the appraisal conversation.
Come in.
Sorry.
John,
Yes.
sit down.
Right. We've got an opportunity now to go through your appraisal. Thank you very much for agreeing to spend the time doing that.
Yes, yes.
So, as you know, this is an opportunity for you to look back over the last sort of 12 months or so and get an idea of, you know, what's working and what's...
All right, John, I'm going to stop you here.
Right.
Let's get on with it. We both know what
Okay.
an appraisal is.
Mm-hmm.
Let's just get on with it, shall we? Because time is short, isn't it?
Yeah, so like I say, what this is a really good opportunity for you to look back over the last 12 months.
Yes.
Have a think about some of the changes that took place.
Okay.
And,
Well,
so
I'm ready. Let's go.
Okay.
Okay.
So let's. So the last 12 months, how's it gone?
What?
What did you notice? What was working? What was working less well? What could John do differently? Something you might have discussed is the need for John to be more assertive in the conversation. Let's see a version of what that might have looked like.
Listen, Jenny, I really appreciate the fact that you've put aside this time so that we can have this conversation, but I am concerned that you're trying to rush through things and interrupting me the whole time. And what I want is for us to have a proper conversation where we can both contribute to that. If that happens, I think we can get some real value out of this. But if it doesn't happen, I'm afraid we will have to reschedule for a more appropriate time.
Here's that structure again. What I like, what I don't like, what I want, if you do, if you don't. What's your response to this structure? What changes did you notice in John's behaviour this time? Think about words, tone and body language. Spend some time now considering the distinction between assertion and aggression or passivity. Also consider how you might handle the requirement to build rapport in relation to the need to assert authority. What about setting the scene and agreeing some ground rules? Before John tries this himself, Discuss what you consider to be the most important aspects of ground rules, confidentiality and process.
All right, understood. So in that case, I have no interest in rescheduling. What do we need to do then?
Okay, well, thanks very much for that. And what we've got now is a good opportunity to spend some protected time together to talk through the last 12 months. Think about some of the things, some of the learnings that you've had in that time, and what changes you've implemented as a result of that.
Okay.
My job is to facilitate that thinking,
Right.
and ultimately to summarise in writing the conversation that we're having
Right.
for revalidation. As you are aware, I think, is that this is going to be a confidential conversation between us, and unless, of course, patient safety is brought into that conversation, in which case we'd need to stop the
Understood.
appraisal
Understood,
and
of
bring
course, yeah.
people in.
Yeah.
And the other thing to say on that, but I think you're aware of this anyway from what you filled in on the form, is that when the written information is put down, that will be shared with other people, so we don't
Yes.
need to go into absolute details
Joy.
on
Yes. All right.
on
Yes,
on
okay.
that. And then the final thing to say is this is protected time, and so I've turned my mobile off, and I really want to concentrate on making sure that we have a good couple of hours to go through this.
All right. Well, a couple of hours. If it needs to be a couple of hours, then let's just get started and see how we get on. I appreciate what you're saying. It's understood.
Okay. Well, so last 12 months, how's it been?
How did John do? Let's fast forward the conversation now and see what happens when the conversation hits some turbulence.
Okay, so let's have a look at the feedback from colleagues and patients. So, any thoughts on that?
Not really interested in what they have to say about me. It's irrelevant.
Well, I don't think it is irrelevant, actually. And I know, there's comments here that saying...
I'm not interested in comments from senior registrars who frankly haven't had enough training to be
Jenny, I
making
think
decisions anyway.
Sorry, but I think you do need to be interested in it, because people here are saying that you're
I'm
intimidating.
telling you that I'm not interested in what they have to say. Some
Doesn't
of it is
matter what
very
you're telling
personal
me,
and
Jenny.
irrelevant to me.
No, because...
They have no appreciation of how busy I am. It is almost entirely because of me that we are a top-performing unit.
And if people are saying that you are intimidating, you will not continue to be
If
a
they're
top-performing
saying
unit,
that I'm
will you?
intimidating, they need to look at their own skills. Well, it's ridiculous, isn't it? How can you blame someone else for your own behaviours?
Well, I'm sorry, but if you
Don't
continue...
keep apologising.
Well,
I'm
if
not
you
interested
continue
in
the
people
way that
telling
you are
me
doing...
that I'm intimidating, because I am not. I get the job done. That's what I'm here for. I've been doing it all my career.
No,
I get
you
the
won't-
job. We are...
Jenny,
Don't
what-
interrupt me, John. We are a top-performing clinical unit, and that is because of my behaviours.
And
They
if you
work.
continue the way that you are continuing, and you continue to intimidate
Can you
people...
Stop using that
then
word.
people...
Do you have a vocabulary?
Well, then you are going to be putting patients at risk, aren't you?
What's happening here? What is the data that tells you this conversation is no longer going well? Be specific. Think about pace, volume, and language, for example. What was John's contribution to this? What might he have done differently? A strategy to consider when encountering resistance is to talk about what you're noticing happening in the conversation.
Okay, Jenny, so now let's have a look at the feedback from colleagues and patients. What's your thoughts
I'm
on
not
that?
interested in that.
Right, well...
It's pointless.
Well, it's not pointless, because some people here are saying things like, that you're intimidating.
Yes, I know who said that.
Well, regardless...
Well, he's
I think,
wrong.
Well, I say regardless, I think it's something that we do need to look at.
It's not something we need to look at. I'm not interested in that. Let's just move on.
Look, Jenny, I can see that this is difficult, and it's important that we explore this. So I think we need to approach this differently.
So John has stepped out of the conversation to comment on what he's noticing. John might consider a change of strategy here.
So, Jenny, I am curious as to how you've found this over the last 12 months, and perhaps where some of those opinions and comments might have come from. But from your perspective, how do you see it?
This feedback is not helpful.
Right.
I don't have any truck with senior registrars who really don't have enough experience to be making criticisms, essentially, around my behaviours. Now, it's entirely because of me that we have a top-performing unit. Mm-hmm. It is not because of the European Working Time Directives, which is actually not allowing senior registrars to be putting in the hours. They don't have the experience. They don't have the exposure that I had when I was training, and it's a nonsense. And I'm not interested in reading them telling me that I'm intimidating them, when in fact I have a job to do because they can't do it.
Okay, so you're saying that they don't have enough experience.
No, they don't.
Because of the directive.
And I'm not alone in this, actually.
No, I don't think you are alone. I think a lot of people are concerned about the impact that directive made, and it appears to me that you're also saying that that's quite a frustrating thing for you.
Absolutely, it's frustrating.
Right, and how does that manifest?
Well, okay, so potentially one is slightly more directive, if you like, with on the ward, for instance. Mm-hmm. Potentially one is slightly more critical, because I am fed up with being asked basic questions that a senior registrar should know, and these are putting patients at risk, and I will not tolerate that.
Okay, well then, so the directive has caused frustrations. You don't feel that people are as experienced as perhaps they need to be, or are not getting the experience that they are, and that, as a result, makes you feel very frustrated.
Yes.
And as a result, perhaps sometimes you get more critical than you would like to do.
I'm only human.
Okay, well then, I suppose what's important, then, I think from my perspective, the way that I see things, and partly from personal experience, when I used to work on a ward, I remember a time when a patient actually died because the members of the team didn't feel confident enough to speak out. And I also think, from my position as an appraiser, I mean, you and I both know that there are, trainees will not remain; they will be taken from you. That there's a risk that as a consultant, that if there is continued negative feedback, that will be taken very seriously, and you're putting your position at risk. Now, for me, I believe in the value of that 360-degree feedback. I think we learn an awful lot from our colleagues. It's sometimes difficult to hear, but I think it's very important. And it seems to me that you haven't yet seen the value in that 360-degree feedback. And as you said at the end, we both want the best possible outcome for patients. We don't want to put patient safety at risk. And that is also very important. So it's really vital that when we have this conversation, that we do find a way forward of working together to try and get the best possible outcome for patients, but recognise that these things are important.
We call this model blame-free conversations. Consider how you might be able to use this model. What happens if a doctor with Jenny's experience gets stuck? An approach which might help is adopting a coaching role.
Okay, I'm stuck.
Okay then. Well, I tell you what. Let's try something. Okay. Let's imagine that I come back in 12 months' time.
Yes.
And now the situation is that you've been, awarded the Mentor of the Year. That everybody in the team is joyously happy. What would have shifted? What's changed?
Gosh,
about that?
An awful lot then.
Right.
Okay. Well, this may surprise you. At the moment, I am educational supervisor, actually. Mm-hmm. I have stepped in. A colleague went off sick and I stepped in, but I have had actually no training whatever. And it's a role that I'm enjoying. Mm-hmm. Maybe I'm now thinking that a little bit of training in that area might really help.
Okay. Well, I mean, training certainly would be training available if you think it's going to be useful.
I think it would be.
I mean, maybe this is something that's worthwhile putting together as a part of your personal development plan. It's probably worth continuing the conversation now. But if training is one thing that you think, actually, if I can put that together and get that in place, that might help. Is there anything else that you think, well, actually, this could make a real difference to the way the unit is run and how you're perceived?
Okay, well, the unit runs fantastically well, but I think it's the way in which, with reference to the delightful feedback, I think that I do not choose to be perceived as the ogre that I'm painted.
Okay.
And I am prepared I don't know how, but I am willing to make the changes in behaviour that are required to have a better understanding of how my doctors are experiencing me and my behaviours. And that said, I would like to, to find a way to actually demonstrate that I don't want to be shouting and barking at people in the way that I don't want to be the intimidating character that I'm described.
Okay.
And I think maybe that might be achieved with a lot of my colleagues have regular team briefings. I've never believed in them. Maybe I'm wrong. Maybe that's a way forward. I certainly understand that giving people a sense of direction is empowering and quite respectful as well. And when they know what I hope to achieve on a given project, then they maybe might not be asking such ridiculous questions.
So when you say
on a
team
regular basis.
briefing, how are you going to make that work? What is the difference that's going to happen?
You mean how regular will they?
Well, yeah. How regular will they be? What do you find useful? Because it has to be useful to you and to the unit.
Yes,
so what would that be?
Well, I suppose they will have to be certainly fortnightly.
Okay.
Which is very often. I mean, I'm aware that how much organisation that will take. Although, will it though? I'm just wondering now. I'm starting to think like this. Is it not quite a good idea to have all my team in one room sharing best practice, actually?
So perhaps an objective would be to, once a fortnight, you will get the whole team together to have a team
possible,
briefing.
Yeah.
And do you think it is possible? Do you think that's likely?
I guess I'm in the position to make it possible.
Right.
So if I say it's going to happen, then it's going to happen.
Well, great. Anything else that you think, right, well, I know I definitely need that in place in order for those fortnightly meetings to actually mean something and be valuable?
Well, you know what? If I start seeing a difference in behaviours, if I start seeing less sloppiness, less shoddy behaviours, and then I will see that it is working, and that will galvanise us all, I would imagine. It would certainly make me feel more positive about them.
So, starting next week, what would you do?
Next week? All right. Well, I will have my secretary start some diary dates.
What did you notice John doing there? What impact did it appear to have on Jenny? How committed do you think Jenny is at this stage? How could John check this? Let's see him have a go.
So, team meetings, team briefings, and just as a check, how committed are you to this? If you're marking it out of 10, what would you give it commitment?
I'd say 8 out of 10.
Okay, and so and how might we move that up to 10 out of 10? So you'd know definitely, right, this is worth doing and this is something that I'm going to implement.
All right. Well, I suppose realistically, I'm not sure that members of my team will necessarily come to the meetings with a positive mindset. Maybe I could share with them that I have actually read the feedback and it's had an impact, an impact that I choose to change, and therefore share with them that actually I don't choose to be this ogre.
Right.
And I would like for them to have a different perception of me. And I need to start demonstrating that. And this is the beginning of that. I have a very trusted colleague who I can rely on 100%. And I think I would like her to maybe remind me of the choice that I am now making. And I think that would probably see it all the way up to 10.
So, Jenny, all of that looks fantastic. And I suppose final question really, in 12 months' time, how will you know that you've achieved all these objectives?
Yes, well, so I will have had the training and felt more confident in my educational role. I will ask for some more 360 feedback, actually, which I think was a really important part of this. And also the meetings will be regular. They'll be in place and people will have the right attitude in the meetings, knowing that they're there for a positive. And as there is no Mentor of the Year award, I'll have a word with the Chief Exec and get him to set one up. How's that?
Good.
So John appears to have gained Jenny's commitment. Finally, thinking about what you've learned from watching all of John and Jenny's appraisal conversation, what are some helpful ground rules and tips for you to take away?